Hi, how are you? Irma, nice to meet you. Yes. Is this your first time in the clinic? Yes. First time getting an adjustment? Okay. Well, let's take a look at your scan results, okay? So this is your scan results here. And right next to it, I have a comparison of just a normal, healthy, functioning scan, okay? And as you can see from your results, there are some areas that definitely need some work, right? So what this scan does is measure the electrical activity in the muscles that surround the spine, okay? This area here especially, which is your middle back here. I know you said you're feeling pain in this area here in your middle back, and I can see that here on the scan, okay? I can also see where you're getting the neck and shoulder pain too, and that's causing tension right here. Feel that? Exactly. And this over here. Feel that? Right. And so you have a little bit of pain here as well. And the yellow indicates a very long-term fatigued muscle. So these are very long-term issues that you've been having that hopefully we can fix today. Okay? And my goal is to have you have your skin appearing as normal and as healthy as possible. Okay? So this may take a few adjustments. It may take multiple visits, but my goal is to get you there, okay? Alright. Okay. So what I'm going to do is, if I may, I will be turning your head just to measure your range of motion in degrees, okay? So I'm going to place my hands gently on your neck, like this, and just test your range of motion, okay? Turning you to this side first. Okay, now do you feel any kind of tension on your neck? Okay, can I go a little more? Is this painful? Okay, we'll stop here, okay? Alright, now let me turn you back. Perfect. Okay, now I'm just going to squeeze this muscle over here on your neck. Okay? But I'm going to have to tilt you this way just to actually reach the muscle, okay? I'm just going to tilt your head this way gently. Let me know if you feel any kind of activated areas. Okay. I just want to massage this muscle a little bit, just to make sure I get a fair measurement of your range of motion, okay? Okay. Okay, squeeze a little firm pressure on the muscle. This will help relax it, okay? Now let me just bring you back this way. Perfect. And now on the other side, okay? You're just going to lean your head this way, very gently. Perfect. I'm just going to massage, squeezing this muscle to release any kind of tension that could be restricting the motion. Okay, perfect. And bring you back this way. Okay, good. And now I'm going to just guide your head back. Just guide one hand on your forehead and just one here. And I'm going to just guide your head back a little more. You can stop if you feel any kind of tension, okay? Okay. Okay, good. Do you feel any pressure here? On this side of your neck or on this side? Okay. Let me just put my hand behind your head and bring you back. Okay. You might have some trouble with C6 and C5. Those are just some areas on the spine and the back of the neck that may be causing restricted movement. Okay? Okay. So now I'm just going to move your head down. Okay? Just move your head down slowly. Okay. And let me know if you feel any kind of pain or any kind of tension on the back of the neck right here, on any part of these little nodules here in your spine. I'm just going to poke along the back of your neck and let me know if you feel any tension. Okay, and let's just bring you back up. Okay, again, I think it's definitely can be referred pain from your shoulders. It can be referring pain up to your neck, and this can be causing tension headaches, headaches on this side. Do you feel pressure here sometimes? Okay, and also on this side of your face over here, it can refer pain to these areas and also cause headaches. Okay. Let me just turn you this way. Okay. And let me try again on this side, okay? Turn you this way. Okay. Yes, that's what it looks like. Okay. So let me just give you a good scan, okay? A nervo scan. And then just mark you up so I can know exactly where to make my adjustments on you, okay? Sounds good? Okay, great. So I'm gonna start in the front here, just scanning your neck, okay? Just hold still for me. And it's painless, it's just two little rollers that just roll gently on the skin. And I don't have to press firmly or anything, it's very gentle. Okay. Okay. I'm sensing a little difference here. So I'm going to go ahead and mark. And this can just be washed off with some rubbing alcohol. Okay. Let's try this here. Yep, right here. I'm just going to mark you just a little tiny dot there. So nerves give off heat and the scanner will pick it up. Okay, just gonna rescan this to make sure. I like to triple check. Okay. And I'm gonna trace a little circle right there. Okay. Okay, I'm detecting another little area that's going to need my help right there. I'm going to come around behind you and scan the back of your neck right here, from the base of your skull all the way down to where your back starts. I'm going to scan you there, okay? All the way down. Take some measurements and see any small little heat differences in the nerves, okay? So let's check the back. Scan you from the top. And just rolling all the way down. I'm going to stop midway and just rescan starting from the top of the neck all the way to the middle of the neck. And I'm sensing a little activated nerve there, so I'm going to go ahead and mark and just draw a little circle on you. That's perfect. Okay, now I'm going to just scan from the middle of the neck down to the shoulders, scanning. And I'm just going to do this 3 times, okay, on the same exact spot, because I'm sensing something there. One more time, just to be sure. Okay, and I'm going to just draw a little circle on you right there. Okay. So now you're ready for your adjustments. Okay? I've got all the marks on you, so I know exactly where to adjust you. Okay, and none of these adjustments are anything to be concerned about. We actually do these kind of adjustments here every day. So you don't have to worry about any major adjustments, okay? These are all just your average daily adjustments that we do here at the practice, okay? Alright, so I need you to just take deep breaths. Just be very relaxed, okay? And I won't do any of the adjustment unless I feel like you're really relaxed, okay? So the first one I want to do is just let me have your arm and put it over exactly over your chest like this, okay? And I'm going to come around pretty close, okay? So I'm going to reach underneath this arm. It's going to be kind of like a bear hug, okay? And I'm just going to squeeze gently. And just take a deep breath. Okay, I'm just going to hug and squeeze. And I'm going to gently turn your head as I do that. Just take a deep breath. Squeezing. Perfect. Okay, perfect. Okay, that's good. Okay, good. That feels good? Yes. Most of our patients feel instant relief. Alright, so take this arm and same thing on this side. Place your arm just like that. Perfect. I'm going to place this arm right underneath you here. And like a bear hug, I'm just going to come in very close and squeeze and turn your head as I do that, okay? Take a nice deep breath. Inhale. Perfect. Good. Okay. Alright. How's that feel? A lot of relief, right? Okay. Okay, so now I'm going to just hold you here like this, okay? I'm just going to place my hands right here, right underneath your jaw and around your neck, okay? And I'm just going to make an adjustment up, okay? We're just going to move up. And with my fingers, I'm going to just gently squeeze the back of your neck as I go up, as I make an up motion, okay? Okay. Take a deep breath. Just inhale for me, please. And that's perfect. Perfect. Good. How's that feel? Excellent. So now again, I'm going to place my hands on your neck. And I'm just going to turn your head this way, okay? This way. Just take a deep breath. I'm just going to make this little adjustment. Deep breath. Perfect. Good. Now on the other side, just take a deep breath. Perfect. Good. Perfect. And now I'm going to come around behind you, okay? Okay. So I'm going to put one arm underneath this arm here and just place my hand on the upper part of your chest. And with my other hand, I will put it on the back of your neck. And we're just going to adjust you down, okay? Just take a deep breath and let me guide you. Inhale. Perfect. Excellent. Okay. And I'm just going to put my left arm also underneath where my other arm is and just squeeze kind of like a bear hug. And this is going to arch your spine back, okay? You're going to arch back and your head will tilt up towards the ceiling when I do this, okay? So I'm going to squeeze like a bear hug. Just take a nice deep breath. Inhale. Squeezing, squeezing, squeezing. Excellent. And exhale. Relax. Okay. How does your spine feel? Good? Excellent. Okay. So now this adjustment I'm going to make is from side to side, okay? But I'm also going to lift at an angle, alright? So again, I'm going to place my hands on your neck and also on your cheek, like this, okay? And one hand would be more towards the back of your neck, just like that, yep. So just take a deep breath for me. Inhale. Perfect. Okay. And just come back this way. Amazing. Good. Now we're going to do the opposite hands here. This one will be further back. And this one will be on your neck and on your cheek, okay? Right there. So just take a deep breath for me. Inhale. Inhale. Perfect. And there we go. Now come back. Good. How does that feel? Good? Okay. Yes. Right. I know it just instant relief to those areas that have been just tight, and also just helps release some of the trigger points as well that will help minimize some of those really active nerves, okay? Okay, another adjustment. I want to adjust you down like this. And what that's going to do is just adjust these upper parts right here, okay? And it may not always crack, okay? But still works, okay? Gives a nice stretch. Alright. So moving your head down towards me, okay? You're going to move down like this. Just take a deep breath. Have my hands on your cheeks and fingers wrapped around the back of your neck. Okay, and I'm going to gently pull forward towards me. Okay, take a deep breath. And there you go. Perfect. Perfect. Amazing. How does that feel now? Yes, right. Yes, it just opens up this area here and this back here. It just gives more flexibility and more range of motion to those very tight areas. I'm so happy you're feeling better. Amazing. Okay. So I'm just going to do some minor adjustments on you, okay? So I just need you to relax and just let me hold your head and face and back of the head, and let me just make very small little adjustments, okay? And you can just breathe normally for these because these are very minor and they're very quick. Okay? Okay. And just relax and just breathe normally, okay? Okay, good. Perfect. Perfect. Okay. Good. Good. Okay. Okay. Perfect. How do you feel? Much better, right? You just feel like your neck can move and you can just freely move your head, right? Amazing. Okay, perfect. So now I'm just going to give you a nice neck and upper back massage, okay? I just want to move around any liquids that have been loosened during the adjustment, okay? So we'll start right here on the upper part of your neck. Just gonna go ahead and massage that. Okay. And on this side. And let me just come around behind you and massage the back of your neck. Just gentle little pats on the back of the neck, just to really get those muscles relaxed. I'm just going to squeeze a little firm and trace this muscle from the bottom of your skull down. Just a firm squeeze. Just following this muscle all the way down to your shoulders. Okay. And just gentle pats all the way up. Okay. And just circular motion, massage. Okay, let me just move your head down a little bit like this. Perfect. Okay. Just massage this area here in a circular motion. Just like this. Yeah, I can feel the muscles are very relaxed. can feel a lot of the tension. It has gone. It's been definitely loosened quite a bit. Okay, move right back up. Okay. Just gonna massage your shoulders, okay? Just gonna squeeze your shoulders. Nice and firm. My patients really enjoy this part the most. Just gonna squeeze your traps on both sides. Squeeze the trapezius muscles. Just firmly squeeze and just slide and press down on the traps. Just to really loosen those traps, okay? They can really cause referred pain. Okay. Just gonna do some little chops, karate chops. Okay, right here on the side. Perfect. And then on this side, some little karate chops. And just deep breath. There. I bet you're feeling much better. Yes. Okay, good. So, my dear, that concludes your session here for today. But if you're interested, I really recommend dry needling. Dry needling, yes. I know it sounds a little, but what it is very similar to acupuncture. We take these little needles and we put them directly into the trigger points, and it's the best way to treat the muscles, and I think you'll really benefit from it. Well, yes, it was my pleasure. Thank you very much for coming, and I'll see you again soon, okay? Take care, you be well. Okay, bye-bye.